Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended. And today we are going to deal with this soft gummy cataract, wherein holding this nucleus was very difficult. The probe was just eating away. So then, how to go about managing such a case with a rhexis of around 5.25 to 5.5 mm? So let's go through this case. By now the side ports have been made, capsules stained, phenocane injected, and chamber is maintained with 1.4% sodium hyaluronate. A triplanar incision is being constructed with the help of this 2.8 mm steel keratome. Now creating a flap with this 26 gauge bent needle, and with the utrata, just following the path, and a nice 5.5 mm of rhexis is done. Burping a bit of OBD. Now it wasn't a complete hydrodissection. I could not see the wave, and that is why the nucleus did not rotate. Again, I'm going to inject, and this time I could see the nucleus bulging forward, indicating the fluid is gone in the right place, and this nucleus rotates nicely. Now my aim was to do a direct horizontal chop, but then let's see what was the problems faced. So the patient was a 58-year-old lady with the vision of finger count 3 feet. So I was expecting a harder grade nucleus, but see what happens. At the moment I try to hold it, just eats off the nucleus. So instead of further holding and eating, it's better to do a mechanical chop. So using that gap, now see again, the moment I try to hold, it eats away. So now just by mechanical chop, I'm able to crack the nucleus. The trick is to hold the deeper part of the heminucleus with the probe, and then this karate chopper goes to the far periphery deep and then is brought towards the probe and laterally separated, and we get nice 4 quadrants. And once this one quadrant comes up, rest follow easily. So in this case, if I were to continue trying to hold the nucleus, I would have created a bowel, and then trouble would have started. So I plan to try and go and do a mechanical chop, and without further trying to hold the nucleus, just use this wide 2.8 mm oertli tip. It will nicely hold the nucleus, and with the chopper you can easily chop. Now this is bimanual IA. These are excellent by oertli. No financial interest, but gives a good stability in the anterior chamber and 365-degree access to the cortex. Hands are switched, and you can see that it's nicely aspirating the cortex, and in no time we are done with the cortex and a clean bag. Let's inject the IOL. The leading haptic goes in the bag and the trailing haptic is nudged in, and it's a nice optic cover by the anterior capsular rim, which will ensure a good long-term stability of the IOL. Now OVD from both above and behind the IOL is removed. The wounds are hydrated and the case is done. So the take-home message is: be vigilant, always have a plan B. In these soft gummy cataracts, chopping is a tricky part, but these mechanical chops help a lot, and you can do the case nicely without creating a ball. Do try it next time and let me know what you would have done in such a case. Patient was very happy, and so was I, as I could complete the case with ease. So these soft cataracts are harder to crack and harder to manage, but then we have lots of tricks in the bag. Do it whichever suits you the best. I hope you like this video. Do like and subscribe to my YouTube channel. Thanks for watching.